Dr. Parikshit and Dev both are here. Let me welcome all of you to India's second Metabolic Health Conference. We are holding it and hosting it from Goa. And I welcome Dr. Parikshit Bhattacharya as our next guest. Let me give a brief introduction of Dr. Bhattacharya. Dr. Parikshit is a lifestyle and functional medicine specialist. He's the founder of Healthy RX based in Kolkata. Today, with his passion and resolve of making people healthier, de-prescribing and reversing chronic diseases, Dr. Parikshit has over 8,000 success stories in the 10 years he's been practicing. So, welcome, Dr. Parikshit. Welcome, Dev, both of you. And let us begin this session with a bang. So, I'll ask the first question. Being a mainstream doctor, how did you come to know about and eventually start practicing the low carb diet? Share your personal journey or personal stories.
Okay, am I audible?
Yes.
Yes, great. Okay, hi everyone, and hi Ira, and I think Dave is also there. So I studied medicine the conventional way. My father was a doctor, and in West Bengal, Bengalis, you know, there's this tradition that you have to become a doctor or engineer. Though that was never a pressure, but I just wanted to become one. So then I took interest in general surgery, and then I started following my father's footsteps, and I became a surgeon. And I was also had a special interest in gallbladder surgery. I was with Apollo Hospital, Kolkata, for 16 to 17 years, and I was just going the conventional way. And then what happened in 2012? I unfortunately had a big accident. It was a big motorcycle mishap. I broke my right leg in 7 places. I was bedridden for a year in the year 2012, and my health went for a toss. Now, uh, during this period of being bedridden, I basically just tried to improve my own health. Like, the accident was a motorcycle crash, and I love motorcycling across the country. And my surgeon told me never ride a bike again. And that was not good news for me. So I needed to ride again. So I needed to improve my health. So the first thing which actually got me into this low carb world was a book called Diet Delusion by Gary Taubes. In fact, my brother, he's an architect in UK, he introduced me to this book. So that's where I got really, really keen, and I realized I haven't studied a chapter of nutrition in medical college. And I know we doctors go around giving a lot of advice: eat this, throw away the egg yolk, don't touch red meat. And I realized what rubbish advice we've been giving. So that's how it started. Then I got in touch with Dr. Professor Tim Noakes. This was way back in 2012-13. And that's basically how it started. In 1 year, I was doing martial arts, and the only aim was I have to ride a bike again. So then I resumed work at Apollo from 2013. I was back to my surgery practice, and then I found my first guinea pig. He was my father-in-law. So he was on 64 units of insulin. He was a diabetic with severe diabetic neuropathy for 25 years and an HbA1c of 11. It took me 6 months. He was off his insulin, and his HbA1c was down to 6.5. And that's when I realized, okay, this is interesting and exciting. So eventually what happened, this patient, my friends, family, they knew about it, and gradually by word of mouth, it's spread in 2013. 2015, I realized I cannot be a surgeon and I cannot heal people this way. So I had to quit one. So I chose to quit surgery. And since 2015, I'm doing this full time.
Dave, would you like to take the next question?
Yeah. So, Doctor, you were
Hi.
working at the Apollo Hospital, Kolkata, while advising patients to go on a low carb diet for remission. Wasn't that a conflict of interest with regards to, the stuff hospitals usually say?
One thing is, like, if you look at the business part of everything, where the money is in the sickness, right? There's very little money in good health. So if you look at it from that perspective, yes. But I was a very likable doctor at Apollo. I had good rapport with everyone. And just a small trivia: out of the 8,000 patients I've seen, close to 25 to 30% of them presently are doctors. So look, we doctors very quickly realize that we're not healthy. Look around you. Very few doctors are healthy. So gradually doctors started coming to me, and a lot of doctors from Apollo started coming to me. So when they realized, okay, what I was doing wasn't that bad for their health, that way, yes, the conflict of interest wasn't really apparent to me. I don't know what was happening behind the scenes, but at least on my face, no one said anything. And again, if you ask why should a doctor or why should a hospital like Apollo have a problem with the way we all practice? If it's just pure money, yes, they're not going to have six patients. They're not going to uh, pharmacies are not going to be selling a lot of drugs. That is a problem. But other than that, I didn't honestly face much trouble. In fact, I got a lot of support from my colleagues and the management of Apollo Hospital.
Very interesting. So, how did you eventually end up quitting your hospital job and started practicing as a functional medicine doctor, which I think was in 2021? So,
No,
also
2015
explain,
that
Dr.
was. In 2015, I quit
2015. So, also,
surgery. So
yeah, yeah. So, and how is a functional medicine doctor different from a conventional doctor? And once you say that you're a functional medicine doctor, is that an affirmation that conventional medical protocols that you spent years learning don't work, or what is it? And was there any pushback from your colleagues?
and a colleagues part I've already talked about. When they realized I'm probably their only hope to get healthier, there was no pushback. But uh, if you ask me about, first of all, let's talk about this whole functional medicine thing.
Yes.
Uh, Dr. Roshni, our endocrinologist friend, she, during the first metabolic health conference, mentioned something very nice, which resonated with me. We doctors, when we specialize, we are so trained and focused to think about only one specific thing. If your eye is a problem, let's fix the eye. If your knee is broken, let's fix the knee. So it's things like that. And in doing so, we totally ignore almost everything else. Yes, at the most, we might write a referral. Okay, let the nephrologist come and see his kidney, let the orthopedician come and see his knee, but we don't look at the whole picture. So that's where, this functional medicine or lifestyle medicine comes into play, where yes, it's more time consuming. We have to really dig out a lot of information from the patient. But when we have the whole picture, it becomes much easier to treat the patient. So that's basically what functional medicine is. And I feel every doctor should develop this habit. One of the biggest complaints most patients have is my doctor saw me for only 5 minutes or 10
Yes.
seconds. It's that bad now. Yes, one reason to blame is the doctor patient ratio. So many patients, less doctors. But even then, I've just felt like I take 1.5 hours with each patient. So I don't see too many patients a day. But I feel unless I give time to the patient, I'm not going to dig out all their problems and I won't be able to treat the patient as a whole. And I think you had another extension to this question. What was it?
Oh, I just wanted to ask, is there any pushback, which I think you've already answered?
Yes, yes.
So the difference
Not
between
really.
functional medicine and a conventional doctor. So the point was the affirmation, which also I think you cleared, that the conventional medical protocols are maybe non-responsive, and that's why the need to look at various other aspects also.
Modern medicine is fantastic in certain areas. Trust me on that. Like,
Mm.
uh, think of antibiotics, think of vaccines, not the COVID vaccine.
Yes,
I'm not
right.
vaccinated. I slightly have reservations about that. But in general, vaccines,
Mm.
antibiotics, surgeries, science, modern medicine is remarkable in treating patients. But we here at the Medical Metabolic Health Conference are primarily talking about chronic medical conditions. That is where I feel modern medicine has been a bit of a failure. Because if
Mm.
I can take someone off medicine, why would I have that patient on medicine for 20 years, which eventually doesn't cure the diabetes, which is not
Correct.
fixing the hypertension, which is not helping in any way, aside from having 10 other side effects of the medication? And there's a cost
Mm.
implication as well, the cost of medicine, the cost of complications. So that's where I feel modern medicine has not worked very well. And a part of the reason for that is we were, again, a lot of doctors have already talked about it, we were never trained in nutrition, so we have no idea about the association of food with the disease in a good or bad way. So that should be a very important inclusion in our medical college curriculum worldwide. This is a global problem, by the way.
Mm-hmm. Dave, next.
So you have so many doctors who have been healed under your guidance using the low carb protocol, LCHF protocol. So why aren't they doing the same on their patients, or are they?
Okay, you use the word heal. I'll just give you a small bit of information. Does anyone know what the word doctor really means, where it comes from? Like, it's a Latin word. If I pronounce it correctly, it means docere. Now, docere
Mm.
actually in Latin means to teach, a scholar. So I know doctors are put on a high pedestal and all, but aren't all of us trying to do that thing? We're trying to teach. We're trying to teach people. And yes, again, doctors have this very narrow, closed mindset that we think anything outside my medical books is incorrect. But yes, I feel we have to have an open mind. Now, why aren't the other doctors doing it? I'll give you a funny example. Since close to 1.5 to 2,000 of my patients are doctors now, and since I was with the corporate hospital for 17 years, so I have a very good network and I have a good camaraderie with a lot of doctors. So when a doctor comes to me, say he or she is an endocrinologist or a cardiologist, and they're coming to me, the irony is they're coming to me with diabetes. They're coming to me with, like, hypertension. So when I slowly get them off medication, I ask them one question, that why aren't you doing the same? So some have actually, like, off the record told me that, listen, I'm 65 years old now. I've been practicing for 40 years. I have publications. I've given lectures all around the world. So right now, that would mean I have to accept that everything I said was wrong for the last 30, 40 years. And they just say, look, I probably have another 5 years to work. I don't want to go back and tell my patients that I was not giving you the best information. So that's how it is. So that's one part of the story. The second part is, I'm not even getting into that. So that's a very controversial part of the discussion, is about the pharma industry. And look, a lot of what we study in medical books, we have to understand. A lot of patients ask me this: did I study the wrong information? I would not say that
Mm.
exactly, but always try and understand that a lot of the information which reaches our medical books is a result of what? Now, a clinical trial is not like I treat your diabetes, I take you off medicine, and that is not going to be considered as scientific evidence. So, those two brilliant gentlemen who Shashi was interviewing, who did that, case study, that is some evidence, or a huge group clinical trial is evidence. Now, a clinical trial, as we all know, is a very elaborate and a very expensive affair. So, who funds these expensive affairs? As far as I know, close to 90% of these clinical trials are funded by the pharma industry, the sugar industry, the vegetable oil industry. So,
Mm.
eventually, they want the results to be such so that we doctors are going to give medicines, right?
Mm.
So that is why everything we studied regarding chronic disease is not the best information.
Mm. Okay, I want to ask you, Dr. Parikshit, why do doctors deny the anecdotal evidences of remission through low carb that people like us, or who are working in the healthcare industry, they put out every day, and these are client testimonials. So, and there's also a denial of documented studies and papers, researches by doctors themselves who've been practicing low carb since as far back as 200, 300 years of evidence of showing low carb, and that it can put metabolic syndromes into remission. So now, when you are doing the same, being a doctor, do they also oppose you, or is it just non-doctors that they oppose?
Yeah, there's a mixed bag of doctors. Like, trust me, some doctors accept the truth, some doctors will not, again, for the reasons I told you. And uh, look, India, in terms of the healthcare industry, at this present day, uh, you can call it, there's a division in two sections. One is doctors are treating the ill. Second is everyone else is treating them. Now, that everyone else could be nutritionists, could be health coaches, and it could be even influencers on Instagram and Twitter. But I tell doctors and even the general population with a lot of pride, Instagram, Twitter, if you choose carefully, there's way more solid information out there, valuable information, accurate information than what the doctors are giving out in terms of reversing or putting chronic disease into remission. So I know we doctors have always had this. We try to make fun that, okay, also you're taking advice from Google or from Twitter or Instagram. But trust me, there's so much good information out there. Just think of us, like this whole group who's on Twitter. And, Dave, he has been treating and healing patients just via Twitter. And I've seen his results in Kolkata. He's been doing fantastic. So it's very difficult to really pinpoint the reason why a doctor is denial. But I've already told you. One is the fear to accept that I was wrong. And I feel that is something a lot of us Indians have. It's very difficult for an Indian. I've been working in UK as well for a while. Over there, the lovely thing there is if I don't know something, I have no shame in saying that. But here,
Yes.
people are fearful to say, okay, I don't know it. So basically, yes, I know it. And what I know is the only way to go about it. There's no second way. That's probably the reason.
Mm,
Maybe
mm.
I started at a younger age, so I had that courage to say, okay, whatever I read was rubbish. Let's start afresh.
I think Dr. Gary Fetke had in the last MHC very magnanimous and very wise of him to give that statement. He was there at the first MHC and he said it is time for his doctors to start saying sorry and that we were wrong. I mean, that's how we should begin. And it's as
Absolutely.
simple as that to move on forward. Yeah, Dave,
Absolutely.
can you please take the next question?
India now ranks third globally in obesity, and 46% of the population in West Bengal is said to be obese and has a high prevalence of diabetes, despite the meat-centric diet. What is it
Mm.
that might be going wrong here in that way of that they are eating, right? And what kind of patients do you commonly see in your clinic every day? And does putting them on a low carb diet help?
Okay, so let's break this into three parts. What is going wrong? What kind of patients? And does low carb? Now, what goes wrong is happening very, very early in everyone's life. Dr. Roshni raised another thing. She said in West Bengal, I think, two out of three kids have raised triglycerides. I didn't know that. So thanks for that, Dr. Roshni. And one out of four kids under 10 have high HbA1cs. So that's what I also see. Now, the problem starts very early. Schools, like I have a lot of obese kids and pre-diabetic kids coming to me. So the first question I ask is, what do they serve you in the school canteens? Okay. I ask you, has your teacher ever taught you nutrition? And there's no nutritional advice. There are no life skill advices in schools in India. So that's where the problem starts. If you go back even earlier, the moment breastfeeding has been stopped, what is the child put on? Formula milk, Cerelac, and all that, Pediasure. These are nothing but sugar, 70% sugar. So that's where the addiction starts. Addiction towards
Mm.
sugar. And sugar, like, as the carb addiction Dr. Robert Sires says it so beautifully, it's a drug, it's not a food. So the moment you have succeeded in addicting a tiny baby, that baby is never going to go back to, high protein and high fat. They're going to want sugar. So that's where the problem
Mm.
starts. And then it trickles on. And yes, in West Bengal, rice is part of the staple diet, but also try and understand one thing. Rice, or what else is famous in Calcutta? Rasgulla, right? I've done talks
Mm.
where I've gone on stage and the topic of my talks have been, is Rasgulla healthy or not? So, it's not a rice which is the villain. It's not the Rasgulla, the sweet, which is the villain. It's about our behavior and our relationship with that. I can give
Mm.
a glass of alcohol to an alcoholic, and that person is going to be in
Mm.
trouble. I can have a glass of alcohol in moderation once in a while. That's not a problem. So, what I'm trying to say is, yes, we all know. Like, even look at the ICMR booklet. ICMR is the Indian Council of Medical Research. You open their booklets, you see their recommended diet to the Indian population. It's well over 200 to 300 grams of carbohydrates and very little
Right.
protein and
Yeah.
almost no fat. It's in a way like elaboration of the pyramid, which we talk about, the food pyramid.
Mm, mm,
So the reasons trickle down to the companies trying to addict a baby, and then the addiction goes on, and then the lack of education, the lack of awareness, and then it's the relationship we have with the carbohydrates. Like I love my carbohydrates. I will like be lying if I tell you that I probably like a piece of fish more than a blueberry cheesecake. I'd love the blueberry cheesecake any day more than the piece of fish. But
mm.
that doesn't mean I'll overdo it. If I have it in moderation and then have more of the protein and things like that, I'm fine. But it's just that we've got it all wrong in terms of the proportion of what we eat.
Mm.
And in
Dr.
terms of
Parikshit,
my, okay, you carry on, carry on.
yeah. My next question was that doctors have not been taught nutrition now. That's common knowledge. We have at D-Life 19 doctors enrolled with us in the D-Life diploma course. And D-Life, as you know, is the biggest course in the world on low carb nutrition and metabolic health with 60 CPD hours credit. Do you agree that doctors need to learn nutrition instead of giving wrong or bad dietary advice to people?
Yeah, obviously. Like food is probably like the biggest trigger for most metabolic and chronic diseases. So unless you're teaching that, like I was trained in medical college to try and find out what disease someone has. And once the disease has already hit you and the labs show you've got the disease and your health is
Mm,
already downhill, that is when I'm taught, okay, let's give you a medicine or let's perform a surgery. But what if I could diagnose the disease way before it happens? So yes,
yes.
again, we were never taught in medical college to look at insulin resistance. Things like diabetes. All our treatment is very glucose centric. It is not insulin centric. So insulin resistance has already happened, and then we start giving medicines. But if we could diagnose the insulin resistance early, we would have, stopped the diabetes or any other metabolic disease before it happens.
Mm. They,
So, with the metabolic disease prevalence in India, should people be trusting dietary guidelines given out by these various associations anymore? And at whose behest do you think are such bad advices given? And is there a larger motive?
The poor health of the population of this planet is all political and monetary. That's where it all starts. Like, if my figures are correct, I think till the 1950s or 60s, there was very little diabetes or obesity or cardiovascular disease across the planet. So, again, I might be a bit wrong with the dates, but I think in the 1950s or something, the American Heart Association was formed and they started publishing dietary guidelines. They were the first who came out with this booklet, Dietary Guidelines. I think this happened in 1961.
mm,
So prior to that, there was very little chronic disease. And prior to that, what would we cook in? Lard, tallow, ghee. That was the cooking medium. And everyone was having just
yes.
like, meat and fat and stuff like that. But the moment, the guidelines start getting published, and then you just open any resource on Google and you'll see chronic disease starts going up from 1960, 65. And American
Mm,
Heart Association suddenly tells you, stop using ghee, stop using lard and tallow, use refined oils, seed oil. I think that was a cotton seed oil, a company called
mm.
Crespo. And by the way, it was made
Crisco,
by a
yes.
company called Procter and Gamble. And by the way,
Mm,
Procter and Gamble donated American Heart Association $1.5 million then. So,
yes.
it's all like very, very fishy. And yes, again, if you look at the timeline of the human evolution, imagine a football field. I read this
Mm,
nice comparo in a book called, I think, Unconventional Medicine by Chris Kresser, I think. So if we imagine that the entire timeline of the human existence is like a football field, say a football field is 100 yards. Some records say we humans have been on planet Earth for 300,000 years. So 99.5% of that football field, we have been hunter-gatherers. We've just eaten meat. We've hunted maybe an occasional seasonal fruit. Now, the remaining zero point 0.5 of this 100 yards of our evolutionary existence The first point three is the advent of agriculture. So that's where all started going wrong, wheat, flowers, and all. And the last point two is industrialization. So that's where packaged foods and all these processed foods started coming in. So the reasons, we can just go on it's been going on, but it's mostly monetary and political. And that's where we have to really fight back and try and make changes. It's going to be a long battle, trust me. And another thing about our chronic health is partly genetic. The thing about genetics is, what is evolution? Evolution is how our genes deal with change, right? Now, I don't know if I can handle a donut every day 10,000 years later, like humans. We might be able to. But 99.5% of our existence on planet Earth, we have eaten in a certain way, okay, meat. And suddenly there was a huge shift, and our genes could not handle that change. And that is the reason. So
I'll ask, you wanted to add something?
No. Carry on.
So I'll ask the last question before I think we can take a Ranveer in. So, as something to ponder about mostly, but I think you can give a comment on this. As governments the world over are bringing doctors under the legal ambit and larger accountability because it involves dealing with human lives, our government, or in India, on the other hand, doctors have been put out of all legal scrutiny and given them exemption from even a serious situation like death by negligence under Section 304. Being a doctor, how ethical and how justifiable do you think this is? Because we are talking about humans here.
Okay, I've got a very interesting answer to this. First of all, negligence. The word negligence, I think the whole medical world is going to point a finger at us. We are being negligent by giving high fat, right? So negligence is very subjective, number one. Number two, look, medicine is a strange science. Medicine is not mathematics. 2 plus 2 may not always be equal to 4. Okay. In fact, if you go into my medical books, most of the things in my medical books would say such and such may cause this. It'll never be written such and such will cause this. So there's always that, may or possibility element because it's not like mathematics. So when it comes to proving negligence, that is a very tricky area. It depends on who is there to prove the negligence. Sometimes it's not even doctors. So that is one gray area. Secondly, right now I'm a senior doctor. I've been practicing for 20 years. But in my early years, we have faced it. And even till this day, it does happen. Indians, or the way it works, the structure, we can become very quickly impatient. So I've seen so many good doctors being beaten up. Okay. I've been seen so many clinics being rampaged through. So, this is partly a protection towards doctors to kind of fearlessly do their practice. But that doesn't absolve a doctor of the fact that, yes, I can also categorize negligence as, okay, if you know nutrition is important, what is stopping you from learning nutrition, right? Because if you are seeing around you, and remember, this will happen over time. It's not going to happen all of a sudden, but gradually over time, when doctors realize, okay, just giving a drug is not helping because eventually the patient's not reversing their problem. That is when doctors might start be more willing to accept the science of nutrition. And I think that's going to work. So, this whole what government policies is doing, as I said, politics is something we don't understand. There's going to be a group who's going to say, okay, this is wrong. They should be held accountable for negligence. But as I said, proving negligence is a very tricky thing. And yes, we doctors also have to have that confidence to practice fairly. So always remember one thing, and I believe this very strongly. Doctors' intention is always good. No doctor would prescribe something unnecessarily with a foul intention. And every doctor eventually wants to treat the patient and heal the patient, right? But yes, if I have only half the knowledge, how am I going to do that? And one more thing, one of my, I think, medicine professors in medical college had told me something beautiful. He had said, listen, you're passing your MBBS, and then just know one thing: in 5 years, everything that you studied might be outdated or incorrect. That's how medicine evolves. Okay. So, but the problem is, they never told me which 50% would be incorrect or outdated. So that's all our guesswork. So, it's ever evolving. So I just think we have to keep on evolving with the times to improve patients.
Mm. Thank you so much. I think Ranveer is here. Has he joined?
I did see a pop up, I think.
Yeah.
Hello, hi,
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 Ranveer. I welcome you.
hi, Doc.
Hi.
Nice to see you again.
Great. You've got a beard like me. Nice.
Grayer than yours.
Yeah. Anyway, thanks so much for joining. Big
No,
pleasure.
no,
Thanks
no.
so much.
My pleasure to be here, and my
Yeah, so
congratulations, to all of you, for having this conference and for doing what you guys are doing. Like I told Dr. Bhattacharya also, it's not just me. I feel this is for all of humanity, and I'm happy to be here with you all.
Hmm. Thank you so much, Ranveer, for joining. And I guess there's a personal story of yours with Dr. Parikshit, which
Yeah.
we would like Dr. Parikshit to share. In the meanwhile, maybe Shashi and Anup can also come. Ranveer, Shashi and Anup are the co-organizers of this metabolic health conference. This is the second conference that we are doing. The first one was in October 2023, and that made its way into an international journal in a case study published from India. That was mentioned. The impact of the first metabolic conference was mentioned in that. So it created big impact. Now we are in the second one. So covering a lot of issues like mental health and stuff like that, cancer and all of this. So Dr. Parikshit, why don't you begin with Ranveer's story and how did he come into Loka?
Okay. So, if you look at his profession, it's very hectic, it's very erratic, long hours of work. Once I actually saw him doing a shoot, and I was saying, like, how can they do that? The patience they require, the energy they require. We just see the rosy side on screen, but the hard work that goes into it is insane. And then they're always traveling across. So at that time, we had just had a chat, very informal chat, to discuss certain issues which he's having. And then once he was not shooting for a while, that's when we got in touch, and that's where it all started. So I think it's better if Ranveer talks about it and he tells us exactly what was going on. So Ranveer, the stage is all yours.
Yeah, well, actually, I met Dr. Bhattacharya on a shoot, and he told me he's a doctor, and I very casually, how it is when you meet a doctor, you want to mooch off some free advice. So I have a mild hypertension problem, so I brought it up with him, and I like to think of myself as somebody who likes to be aware of generally science and also health. So I would say I'm a at least well informed about the different developments that happen in the field of science and health. But so I had tried before that ketogenic diets and all, not for my hypertension, but for various other reasons, for bodybuilding and for body sculpting and all that. So I was aware of different diets and stuff, but um, Dr. Bhattacharya mentioned the one thing which I had not heard of till then. The one term which kind of changed everything for me, which was insulin resistance. So by then I had never heard of that. And so when he brought that up, I told him at that time, he hosted us for a lovely meal. He and his wife. I'm still grateful for that. And we chatted over the meal, and I told him, okay, I'll go back and I'll get in touch with him. So I came back. I looked up a little bit on insulin resistance, and I thought that, okay, this is not something which I've looked at ever. So then I called him, and I fixed a time with him. He gave me a set of tests and all to get done, and I followed it up, and it turned out to be exactly what the readings that he mentioned, The parameters turned out to be exactly what he was saying, and that's when I started taking him, seriously. Because but by then, till then, it was for me more a social interaction than healer patient interaction. And then he told me, he gave me certain guidelines, what to do, what not to do. So by then I was already aware of intermittent fasting, and I was trying, and I was doing it also, but I was doing it wrong. So he stepped in, told me what all I should correct. A lot of other, great advice which he gave me. And so I think I met you May last year, Doc, May or June last year. I remember it was very hot. We were shooting in Bengal, yeah. And so I did my birthday is in August. So every August I do my annual health checkups. So in August I did my health checkups. I sent him the reports. In between, also I had my niece's wedding to attend in the US, so I couldn't really start with the the parameters that he wanted me to. And I told him this. He said, he looked at my reports and he said, it's okay, you can wait. You go attend the wedding, enjoy the wedding, come back, and then you start this. And then I started. Yeah, I mean, I had just doing them for a bit already improved my my blood work parameters. And then when I got down to doing it properly the way he wanted me to, I think my health really improved. Now, of course, Dr. Bhattacharya, being a trained doctor, he was what he was reading. He was impressed by the numbers, which mean actually nothing to a layman like me. But even those numbers, if you see them, I don't know if you want, maybe I can look them up and read them for you. But the point being, apart from the numbers, what really got me really impressed with him, and now I call him my health guru, is how I was feeling. Never mind. Now in the last 1 year, I've lost almost a kilo a month. So when I met him, I was about 80, 81. Now I'm at about 74.
Okay.
And I'm saying this is without taxing my body in any way. So here are the numbers. This is the EGFR readings, which I think speak for his work.
One more thing, EGFR readings after I increased your protein intake a lot, right?
Yes. So, he told me to focus on protein.
Okay.
So in 2022, my EGFR was 68, which is quite bad. In 2023, after I met him, and I had kind of started proper TRF and intermittent fasting based on his advice, but not really 100% doing it because I had a wedding to attend. Let's not forget that. So there was alcohol, sweets, and all involved. My EGFR got to 80. So almost 6-7 months after that, because I wanted to be sure that I'm not harming my body doing this, I did another set of blood tests. Normally they're due in August, but I did them early just to be sure that I'm doing this for 5-6 months. I don't, maybe he's experimenting on me, like in a Frankensteinian way.
That's a general apprehension, and people usually prefer to do that midway.
Yeah. So I got one done. I don't remember when this was. I think in March, Doc. I'm not sure.
Yes, March 2024. Yes.
Yeah. So 2024, my EGFR is raised to 87. I am hoping that if I continue this, by the time my tests are due again in August, I am hoping that I'll have my fully functional, according to the WHO standards, fully functional kidney at 90, at least. So this is my story, and I mean, obviously, Dr. Bhattacharya knows how grateful I am for all that he's done for me, and I think I think the biggest, I've been listening to a little bit of the chats that you guys have been having here or at the conference. It reminded me of, like I said, I keep getting these science alerts on what's happening in the world of science. And I remember reading one article that big pharma are actually funding a tablet that will replace exercise.
Yes.
So I think that is the problem. Is that we don't want to put our bodies through what our bodies are designed to, but we want to just sit on our butts and just take a pill and get everything right. Yeah. I hope I'm not missing out
Ranveer, thank you
anything.
so much for this, for sharing this wonderful story and journey of yours. And I'm sure you'll feel much better under Dr. Bhattacharya very soon. Shashi and
Yes.
Anup are the co-organizers, as I
Yes, of course.
introduced
I
them.
follow
Would
them
you like
both on
to?
Twitter. Yeah.
So
Not me.
Ranveer, thank you very much. Your story is very inspiring, and thank you for
sir.
taking time out and coming in this conference, because
I'm a huge fan of Dr. Bhattacharya. Yeah. I'm a huge fan of Dr. Bhattacharya.
An actor celebrity coming and endorsing this and raising your eGFR from the 60s to 80s and getting back to normal. I'm sure your story is going to be inspiring for many to take up low carb nutrition under Dr. Parikshit. So thank you very much.
I just want to add, sir. I think, this is what I gather from my own experience and from whatever I've read up on based on the guidance that Dr. Bhattacharya has given me. I think it's a combination of TRF, low carb, high protein, and exercise. I cannot stress that enough. That I don't think even low carb would work without TRF and exercise.
Thank you, Anup.
Thank you, Ranveer, for coming and sharing your story. And best case we can hope is the media picks it up and gives it publicity, because one death because of they start blaming ketogenic diet, and it then goes viral. So it increases our task, as health coaches or doctor, to again get back to basics and start explaining. So we hope the media.
But I would really I would really caution you guys not to keep your hopes too high on that end till you are generating enough revenue. Because I have been in show business for 30 years, and I can tell you, media and, like Dr. Bhattacharya mentioned, politics. Media and politics moves where the money is.
Absolutely.
So all the best for that. And I'm here because I'm not attached with any FMCG brand or a giant pharmaceutical, so I can safely be here. But with the mainstream, whether it's media or whether it's politics and the likes, I stand by you guys, because you stand with the truth, and you're doing something which is good for all of humanity. So I stand with you in that spirit completely.
Thank you.
Thank you very much. And
Thank you so much for coming, Ranveer, Dr. Parikshit.
My pleasure.
Shashi,
thanks so much, Ranveer.
Yeah. Whenever Dr. Bhattacharya calls, I'm here.
Thank you so much.
I want to thank Dr. Bhattacharya. Dr. Parikshit, I want to make a statement for you that let this be on record that Dr. Parikshit is the Atkins of India. He has treated the large number of patients, and I suggest that you start publishing case studies and start auditing your clinic, get it published. India requires your database. Thank you very much, Dr. Parikshit.
And my EGFR readings, EGFR readings are available.
And one last thing I'd like to tell you. I know we all talk about low carb and getting healthier, but probably why I have seen so many patients and why patients tend to love me so much is I try to make eating fun. Look, the art is how to eat unhealthy at times and still stay healthy. So once you've mastered that with a combination of everything, exercise, fasting, and in moderation choosing the right foods, you never feel deprived, because deprivation is never going to work in the long run. You have a lot of willpower, you can do it for a while. So we have to kind of make medicine a bit less serious, make it a bit more fun, and keep people going. That's my message.
Thank you.
Thank you, guys.
Thanks.
Bye. All the best. Yeah.